Port Huron, Michigan. It's known for many things. Sharing an international border with Canada, the boyhood home of Thomas Edison, and its place as the maritime capital of the Great Lakes. But it also has a significant place in the annals of the healthcare profession. Port Huron's Pioneers of Medicine. Port Huron's role in the advancement of medical practice was shaped by 4 great doctors. Each of these pioneers of medicine had a different area of specific interest. Yet interestingly enough, their work also had many parallels. Each was born elsewhere, but chose Port Huron as the community in which they would build their careers. Each was a physician in the United States Army, first applying their prestigious professional skills during wartime or immediately after. And each left a unique legacy to their adopted city, and more importantly, to the practice of medicine around the world. 3 of these men came to Port Huron after World War II. Although they were contemporaries, each followed a separate path to the city and devoted himself to an individual medical specialty. Dr. Nicholas Douvas would revolutionize cataract surgery, giving thousands of people the opportunity to see clearly again. Dr. Charles Townley's innovations in the field of orthopedics would offer new hope for many, so they could once again move without pain. Dr. John Coury would become a driving force behind the need for physician collaboration, rising to top medical leadership roles in the state, nation, and the world. However, the stage was set for these innovations in medical history a century before these men arrived in Port Huron. In 1850, a young surgeon named Cyrus Stockwell arrived at the small military outpost town of Port Huron. Born in 1823 in New York State, Stockwell first studied to be a teacher before realizing medicine was his true calling. Dr. Stockwell practiced medicine in Port Huron until the outbreak of the Civil War, when he joined the 27th Michigan Infantry as an Army surgeon. During the war, Dr. Stockwell's medical career became more focused. At the Battle of Vicksburg, Dr. Stockwell had to deal with incredible loss of life and limb among the troops. Disease was rampant in the battlefield hospitals where he worked. Dr. Stockwell himself contracted typhoid fever in 1864. Although he survived, it is now known that more Civil War soldiers died from sickness and disease than from bullets and swords. Dr. Stockwell's experience under these difficult conditions led to his lifelong interest in communicable diseases and the study of hygiene and sanitation. Later in his career, he published several papers on the study of cholera and dysentery in the Journal of the American Medical Association, and became an early national advocate on the types of sanitary medical practices that soon would become standard.
Dr. Stockwell, being a learned man and having experienced some of these terrible epidemics firsthand, became an advocate of clean water and sewage. Cholera is not transmitted from person to person, it's transmitted from contaminated water and food. So as this concept spread, and it spread only because there were people like Dr. Stockwell who were proponents of it, they were able to eliminate cholera.
After the war was over, Dr. Stockwell returned to Port Huron and resumed his practice. The Fort Gratiot Hospital, where he worked, still exists today. Although badly in need of restoration, it is the oldest wooden structure in the city. Dr. Stockwell is remembered for being a compassionate doctor who made a living helping the less fortunate. In the Cyclopedia of American Medical Biography, Dr. Howard Kelly reported that Dr. Stockwell often traveled over 60 miles a day around southeast Michigan. Dr. Stockwell wanted feisty horses that would be up to the challenge of traveling long distances over bad roads, or no roads for that matter, without tiring. He once said that The vicious and the ugly ones could withstand the most wear and tear. His son, Cyrus Stockwell, told a story of one such journey. One day, he and a druggist started for Detroit at 4 a.m. They went to Detroit, transacted their business, and reached Port Huron at 12 midnight, making distance of at least 120 miles. Yet, the following day, the horse was as lively as ever. To appreciate the effort it took to travel around Michigan in the mid-1800s, Charles went on to say that in making his long drives, when he came to a tree fallen across the way, he would unhitch his horse, lead it around the tree, then drag the sulky over and rehitch his horse and move on. It was common for Dr. Stockwell to travel great distances to provide medical attention to those who could not seek it. Dr. Stockwell's creativity and achievements led to his election in 1864 to the University of Michigan's Board of Regents. While in this position, Dr. Stockwell voted to allow women to study at the school, an opportunity previously restricted only to men.
At that time, in the late 19th century, was groundbreaking. Because here's a university that basically had catered to the study for men, and they made a decision to allow women to attend the University of Michigan. So he was part of that historic decision.
He also was a founder of the Michigan State Medical Society in 1866. The society provided a network for doctors to improve the field of healthcare in Michigan through clinical education and public service.
He founded the Michigan State Medical Society, and he was the first president. So he was very influential in getting other doctors to adopt his ideas, and also to take on to establish the educational role of the society itself. He was one of those people early on in the 19th century that helped set the pace and the tone of professionalism in healthcare field.
Nicholas Douvas, the son of a Greek immigrant, was born in 1921 in Hastings, Nebraska. The teenager, who would later be world-renowned for his work with the human eye, was an intelligent, athletic student with bright ambitions. In college, he studied medicine at the University of Nebraska, earning his medical degree in 1945. He then completed his internship at Boston City Hospital. Dr. Dubis joined the U.S. Army Medical Corps and served from 1946 to 1948. His experiences there led him to choose ophthalmology as his specialty. He did his residency from 1948 to 1951 at the University of Iowa. After another year of ophthalmology work at Henry Ford Hospital in Detroit, Dr. Douvas joined the Port Huron Hospital staff and opened the Port Huron Eye Clinic. Dr. Douvas was interested in improving the quality of life for patients with chronic eye problems, particularly cataracts caused by trauma and birth defects. That challenge was significant. Normal cataracts could be removed by conventional surgery, while cataracts caused by birth defects and trauma could not. The risk of removal is high because it can damage the retina. Dr. Douvas found that traditional needling, which was the common practice of removing mature cataracts, led to scarring and additional surgeries in young people. Through frustration of this type of surgery, Dr. Douvas set out to find a better way. In 1968, he found one. His revolutionary technology was called the roto-extractor.
Within this needle was a little drill bit, and that drill bit moved around, and at an opening in the tip of that needle, it would cut anything in its path on each rotation. So this needle portion would go into the eye. The surgeon would hold the large handle, and within the handle was the motor that would spin the drill bit, an aspiration system that would pull away the material, as well as an infusion system that would put fluid back into the eye.
Working in a small basement workshop in his Port Huron home, Dr. Douvas kept refining the roto-extractor. It was initially developed for juvenile cataracts, but was also found useful for diabetic patients who had hemorrhaged due to complications from chronic diabetes. The roto extractor allowed thousands of people to gain sight, of which prior to the roto extractor there was not a method to do this surgery.
The evolution of the equipment permitted repair of eyes that were previously not salvageable by the techniques at the time. It permitted a removal of cataracts through a smaller incision that allowed a faster recovery and better results all the way around. He was definitely an innovator. He was definitely ahead of his time as far as patient care.
In the following years, he obtained dozens of patents, and he further refined his device. He also filmed and videotaped his surgeries and trained doctors from all over the world on how to use the roto extractor. Dr. Dubis insisted that people or organizations that purchased a roto extractor be trained in its use by him. As Dr. Douvas said, the fastest way for a machine to get discredited is to let someone use it who doesn't know how. At one time, the roto extractor was used in more than 300 hospitals in North America. Dr. Douvas served on the guest faculty at more than 17 universities and spoke worldwide about eye surgery technology. He also published his findings and research in more than 44 manuscripts and medical journals. He traveled with the roto extractor to England, France, Greece, and Switzerland, and other countries. The roto extractor revolutionized the way cataract surgery and vitrectomies were performed, and in many cases, gave patients the chance to regain the sight that had been lost.
I think he was only 17, and he was flown in by private airplane from Wisconsin to the St. Clair County Airport and brought in for Dr. Douvas to do his surgery. I don't recall what caused the trauma to his eye. I just remember that, wow, they're flying in patients on private planes just so Dr. Douvas could do the surgery.
In 1974, a national magazine wrote an article about the revolutionary roto extractor. The article told the story of Warren Freed, a Dayton, Ohio telephone lineman who lost his job after being blinded by injury-related cataracts. In the article, Mr. Freed said, "Doctors told me earlier I'd never see again. But the morning after Dr. Douvas operated, when they took the patch off, I could actually see." Dr. Douvas had restored the sight in Mr. Freed's right eye. 25 years after that article appeared, a visit with Dr. Douvas changed the life of Katie Reppenhagen, who was born with Marfan syndrome, a genetic disorder which can affect many parts of the body, including the eyes. She began having vision problems at the age of 2.
My eyesight had become so bad that my lenses had dislocated so that just the very tips is what I was looking at, and this is why the loss of eyesight was so gradual, and I was getting to a point where I was going blind if I didn't have something done.
But after 2 surgeries, Katie's eyesight was restored, thanks to Dr. Douvas.
Someone of Dr. Dubis' caliber is not only a pioneer, someone of his talent is, they're born, they're not made. If he could only realize how many people's lives that he saved. I consider him saving my life for the fact that I wouldn't be sitting here today, I wouldn't have my eyesight. I actually had other ophthalmologists tell me that they had to wait until I lost my eyesight before they could do anything, and then they would see what options were available for me. He was the only man that was confident that when he told me, this is your problem, but we can fix that, this is what we're going to do, everyone else was frightened to touch me. Nobody wanted to handle my case. I guess I just can't say that words to say thank you to Dr. Douvas are not enough. He gave me a whole new life that I never knew existed, and for that, I will be forever grateful.
He's brilliant. He literally, his vocation turned out to be his avocation. He spent 24 hours a day, 7 days a week doing ophthalmology, and he had an incredible intelligence. and he was physically gifted. He was a good surgeon as well as being really bright, and he was driven. I mean, he said, wow, here's an area that hasn't been explored, and I have all of the capabilities to be the one to lead the way, and he did. And he was a rare individual. He has to be close to what you would refer to as a genius. He was an amazing personality, and have somebody like that, you know, here in Port Huron, he could well have been at any major medical center in the entire world.
I think asking how valid Duvas's contributions is really not unlike saying, well, how valid was the Wright brothers' plane in modern aviation? People that were contemporaries with Nick at the time in the early 70s took that bold step with their patients and saying, well, let's try to do this safely, and he realized they could. And it really is, you know, he was a Wright brother of his time for ophthalmology.
John Coury was born in Wheeling, West Virginia, a mining and steel manufacturing town, and grew up during the Great Depression. He earned a Rotary Scholarship to attend college and graduated from Washington and Jefferson College in 1942. In 1945, he received his medical degree from Western Reserve University. In the years that followed, his upbringing and education would lead him to become a top medical spokesperson for Michigan and the world. He began his medical residency at Detroit's Harper Hospital, but in 1946, he was called to serve 2 years in the U.S. Army, where he held the rank of captain when he was discharged. After serving his country, he returned to Harper Hospital to finish his training in pediatric and general surgery. In 1952, Dr. Anthony Goltz, a pediatrician who had worked with Dr. Coury at Harper, convinced his former co-worker to come to Port Huron.
He was always looking for ways of practicing medicine in a better way and projecting the face of medicine in the long term in the best way possible. He was a very honest man. He had a lot of clinical ability. He could diagnose well. He was not quick to operate on anyone without knowing ahead of time exactly what he thought was going on.
He was one of these guys who could come into a room and, as a physician, as a doctor, and immediately establish a bond with a patient and make them feel like everything's going to be just fine.
Oh, when we went into practice, or when I went into practice, and my generation went into practice, our idea was just to get out and do the job we could. We didn't worry about medical liability. We used everything that we could in our own armamentarium to do the best job we could, and all we were concerned about was delivering quality care.
Although Dr. Coury's reputation among his patients was high, it may have been even higher among his peers. Dr. Coury believed that doctors needed to be connected with other doctors to make certain that the best practices were spread through the profession quickly to provide the best medical care possible. He was a lifelong advocate for doctors and the medical profession. Dr. Coury felt that organizations such as the St. Clair County Medical Society, Michigan State Medical Society, American Medical Association, and the World Medical Association were crucial to doctors working to improve medical care. In 1965, Dr. Coury was nominated by his peers for a Michigan State Medical Society commendation. The narrative states that Dr. Coury is an inspiration to young people interested in entering the field of medicine. He has always exhibited a deep interest in the welfare of people and their relationship to organized medicine.
He stood for the right thing. I mean, he had an absolutely profound sense of what was right, and he didn't hesitate to speak up to anybody about what he thought. He was highly respected for that. He became sort of an arbiter. People would say, well, you know, let's consult John on this, and because he was sort of like the final word. He was the judge.
He became president of the Michigan State Medical Society in 1972. In 1973, He wrote in Michigan Medicine magazine that he personally felt that one of the great challenges facing doctors was to make good medical care easily accessible to every resident of Michigan.
Well, John Coury was a very good friend of mine. He preceded me as president of the State Medical Society. I had not known him before that time. And he was a good example for me, a set standard. And he was a peacemaker, which is a pretty essential thing when you get a lot of doctors together. And he was able to accomplish a great deal because of the personality that he had, which could reassure people and at the same time bring them together.
Dr. James Copping was a colleague of Dr. Coury throughout his career.
Basically, what makes John stand out so much differently from other physicians is that he had a great interest in how we deliver medical care, the quality of medical care, the relationships between physicians, the policing of physicians, of other physicians, all meant to improve the care that people got, and particularly the poorest of people. I think he was a very caring person, very intelligent, and able to work with different types and a multitude of different types of individuals that were from the patients to the President of the United States.
In 1984, Dr. Coury became chairman of the board of the World Medical Association. In 1986, he became the 141st president of the American Medical Association.
His entrance into medical politics was not for personal gain, but to raise the standard of the ethics of the administrative forces in medicine at the time.
When John became the president of the American Medical Association, that was a huge morale boost to the medical community. And it put Port Huron and its medical community on the map.
One of Dr. Coury's many contributions to the Michigan Medical Society and the American Medical Society was to assist in the implementation of an international medical graduate program, which helps doctors from other countries succeed and promotes diversity and integration in the medical field.
I remember when we first met him, we were trying to organize a special section for the international medical graduates in the AMA and Michigan State Medical Society. And he helped us get one going. He was a mentor because we looked up to him, and we looked up to him for advice and guidance.
John Coury developed a code for living, which identified ways to live a healthy life, both mentally and physically. One of the codes says a lot about Dr. Coury. Develop a code of conscience, morals, and ethics. If you can't live with your conscience, you may be successful, but you won't be happy. If you do not have ethics, you may be successful, but you won't be respected.
You know, one thing Dad always said to me about his extra medical career in the medical politics is he never sought it out. He said his feeling was if people want his help, his advice, then if they asked him, he would follow. But he was extremely ethical, extremely moral, and didn't pat himself on the shoulders.
In a 1986 Times Herald newspaper article, Dr. Coury explained why he chose to practice in Port Huron. I feel a devotion to Port Huron. It's a good place to live. It was a good place to raise our family. I have enjoyed my practice here. I don't like big cities. That's why I came to Port Huron. Charles Townley was born in 1916 in Minneapolis, Minnesota. A bright student and good athlete, young Charles earned a bachelor's degree from Capital University in Columbus, Ohio, after attending on a football scholarship. He studied orthopedic medicine at Ohio State University and graduated with his medical degree in 1944, at the height of the war. He started his residency at Henry Ford Hospital in Detroit in September of 1944, but was called away less than a year later to serve in the U.S. Army. Dr. Townley served stateside at Fort Sheridan and got a lot of practice in orthopedic surgery. In 1950, he moved to Port Huron and opened a private practice. In subsequent years, Dr. Townley focused on ways to relieve constant joint pain. His innovative techniques ranged from joint resurfacing to total joint replacement. He was the first physician to complete a total shoulder replacement surgery, the first to develop total articular replacement arthroplasty, TARA as it was known, or commonly known as hip replacement, and developed the Townley anatomic knee, which has been used around the world.
Now, as far as the knee was concerned, I got involved in that joint about the same time, and that was stimulated by the fact there really wasn't an arthroplasty for the knee. We were fusing knee joints, which is a devastating thing to do if you have both knees involved, if you have to fuse both knee joints. So I started working on an implant, on a prosthetic implant, a metallic implant then for the knee, and developed both the hip implants and the knee implants. Part of the time I was at Ford Hospital, and then completed it when I came to Port Huron in the early 50s, 1950 as a matter of fact.
His designs were so far ahead of anything else that was being done. Townley was always so concerned about the cases that he was working on. No matter what type of case it was, he continued to think during the week prior to the surgery of what he was going to do and what his backup plan was going to be. You know, if something went wrong, if after he opened up the patient, if it just didn't seem right, what could he do next? I was in Texas for a meeting down there, and at 4 in the morning I got a phone call from Dr. Townley saying, you know, do you have this in the OR? Do you have that? You know, did we prepare for this? Yes, Dr. Townley, you've got everything there. It'll be ready. You know, you should be good to go.
He did things because it was the right thing to do. It was right for the patient. It was innovative. Anything that resulted in, anyone at BioPro will relate to this, anything that meant less bone removal from the patient, he was obsessed with that stuff. Genius, very caring, did a lot of things behind the scenes for a lot of people in this community, both groups and individuals. Never wanted to be thanked. In fact, he would argue against being recognized and tell people that he would withdraw his pledge if they decided to recognize him, and sent me and other people to a lot of events where they wanted to honor him, because he didn't do it to get the accolades. He just did it because it was the right thing to do.
Dr. Townley's work changed many lives for the better. Among them was Anna Strong, a woman who had been crippled by severe arthritis and was using a wheelchair at age 37. She began a series of surgeries by Dr. Townley. In the winter of 1974, after her 6th operation, the young mother of 4 could walk again. Talking about Mrs. Strong and the success of her surgeries, Dr. Townley stated, "This is one of the joys of orthopedic surgery. She has a whole new outlook on life. The pain is gone, and she can move again." Dr. Townley was an innovative thinker who was often frustrated with inferior replacement orthopedic products. He tried to develop joint replacements that followed a total anatomic design. In other words, what natural joints were like in the first place. This led him to establish his own company, BioPro, where he could develop orthopedic replacement components that were built to his specific designs. Townley invested his own money in this new venture so that he could produce orthopedic replacement products that met his high expectations.
The design of the whole company was to bring again the knowledge that he had developed over time and get the products out at a more quick pace, being able to change quickly with findings of what would happen, either in the OR or following up in the patients.
His products were used worldwide, and Dr. Townley himself was in high demand. He was asked to speak all over the world about hip, knee, and shoulder surgery. In his more than 50 years of orthopedic practice, he replaced the pain of thousands of patients with orthopedic joints that he designed.
Wouldn't surprise me if he saw 100,000 patients in his career. We have better numbers on the number of joint replacements that he did, and that's upward of 12,800 something like that. It's a very large number. I have little doubt as far as a personal series, it's the largest that there is. It was such a long career in that field. He was enormously busy for many of those years. He would have 10, 12 patients sometimes at the Port Huron Hospital in a single day.
He brought to the orthopedic community designs that are still being utilized today. His total knee design, which was the first total knee in history to ever been used, is still being used in some form or another with all the knee designs on the market. Without him, we would have been struggling to come up with good products. His hip implant design is still being used around the world. The theories that Dr. Townley came up with and worked with are still very, very important to the community.
He definitely was a pioneer. If you think of a pioneer as a leader in the field who, through innovation, brought new products and ideas for us to treat patients and improve their well-being.
Some thought, well, he goes away, much of his legacy will too, but I don't think that's happening. His ideas are still being acted upon, the spirit of how to do it, and the company itself seems to be, alive and well and innovating, just as it would be were he still here.
The leadership, John Coury, Chuck Townley, Nick Dubis, others in the community, that type of leadership was what encouraged other young physicians to come to Port Huron, and I think has helped us continue the tradition that we have of good medical care in this community.
Port Huron, Michigan was the adopted home to 4 extraordinary physicians who helped advance the practice of healthcare in their own community, in Michigan, the United States, and the world. Dr. Cyrus Stockwell, Dr. Nicholas Dubis, Dr. John Coury, and Dr. Charles Townley. Collectively, they helped millions of people live better, healthier lives and set the stage for today's high-tech medicine. In doing so, they made Port Huron and St. Clair County internationally acclaimed as a leading center of medical progress and healthcare practice in the 20th century.